Welcome, I guess, to day 2 of Stronger Together. I hope that all of you got a good night's sleep. Yes, yes. Any parters in the house? I left the reception kind of late, and I saw some of you out there with probably your third glass of wine, so I don't know. And we're hoping that you're also ready for another day of collaboration, another day of networking, and the sharing of ideas and inspiration. Although we've only been here for one day, I feel like we experienced a week's worth of quality, incredible, intentional programming on yesterday. Wouldn't you agree? Agreed? Yes. Well, first we heard from Professor White's masterful keynote speech about the importance of moving forward with awareness, sensitivity, education toward healthier learning communities, to Dr. Young and Dr. Parham's willingness to share their passion and their expertise as we join together to take our next steps in this long-term endeavor. We began with great wisdom. Yesterday morning was about a lot of wisdom and inspiration, and as the day went on, I could feel the energy and the excitement build. Several themes, though, I think, as I reflect, emerged from very clearly throughout the day, which was the intention of the conference. Collaboration across departments and institutions, consistent messaging and face-to-face education, the importance of individual participation, and a strong sense, and with all of this though, still a strong sense of institutional identity and mission, which is core and critical. In fact, as I was listening to the presenters of UC Strong Case Study, a collaborative response to tragedy, and the synergy, to use Dr. White's words, among those who responded to that awful incident back in May that occurred in Santa Barbara, it was a visceral presence in the room and an important reminder that the work we are doing, that we are all doing, in fact, embodies our highest institutional and community values. And aren't we lucky to be able to work and do the work we do that comports with our own personal values as well? And if not, we're probably in the wrong business. In one session, students talked about their experiencing helping friends and peers and strangers that they had to encourage to engage around a lot of these issues. Staff in some sessions told stories of those who overcame their own personal crises to share their story and their compassion with advocacy, by advocating with others. And what was evident throughout all of these sessions was the passion and the integrity in which all of you approach your work. And that was very, very humbling for me personally. And so, again, there is so much talent and enthusiasm in this room, answering the call to draw student mental health fully into the light and fully into the consciousness of our campuses and our communities, where all of our institutional and legislative leaders understand that we are all enriched when our learning environments are healthy and indeed when they are whole. I anticipate that today will solidify our mission even more, and I look forward to all the good work that will ultimately come out of this conference. And as a culmination of all this wonderful work that you've been doing, thank you once again for being here and for your commitment to overall health and the welfare of our higher education community. I salute you once again on day 2. Thank you. Having said that, we're going to move right into our first plenary. So the goal of this panel is to reflect on the impact of Proposition 63 funds on our systems and to discuss our vision for how we move forward together. We will ask a series of 3 questions, and then our panelists will respond. So I'm going to call up our panelists to come forward now, and actually they will do their own proper introduction. So do we have Ms. Ann Collentine from CalMHSA? She's our loyal, faithful director. Where is she? Oh, she's making her way forward. In that Each Mind Matters green, isn't she lovely? And Gary Dunn, where are you? There you go, Santa Cruz is in the house. Hannah Roberts and Brian Oluwidi. Am I saying that right? Oh, close enough. That's great. So as they make their way, I'm going to take this seat, and you guys can just sit in whichever manner you want, and we will get going. And there will be an opportunity for questions and answers. For questions from the audience. So there will be a mic, Taisha, right, that will meet you. If you have a question, just kind of raise your hand. This is the important stuff, because yesterday we talked a lot about sustainability and what happens post-grant. And so hopefully we'll get some ideas and some best practices around that today. So I'm just going to start from the far left and ask each panelist to just introduce themselves, your connection to student mental health, and anything else you want to share this morning.
All right, thank you. Hello? Okay. Yeah, hi, I'm Gary Dunn, and I'm the director of the CAPS program at UC Santa Cruz. And my connection to mental health, well, we deal with mental health every day, and just trying our best to meet the needs of the students, which are increasing, but that ability was greatly enhanced by the grant, and figuring out where we're going from here is the next challenge. So, good morning.
Good morning. I'm Hannah Roberts. I was a psychologist in Cal Poly San Luis Obispo's Counseling Center when the grant came on board, and so I became the grant coordinator. And as of last week, I have transitioned into the role of Director of Campus Wellbeing, which is a new department that came out of some needs recognized by the grant.
I'm Brian Olawude. I'm the Coordinator of Psychological Services at Fresno City College and Wheaton College. I'm also the President of California Community Colleges Mental Health and Wellness Association and the Training Director of the Central California Internship Consortium. I also sit on the Chancellor's COAGS, which is the Chancellor's Office Advisory Group for Mental Health. And obviously, I have a problem saying no when people ask me.
That's good, Brian. I've got a few things to ask you. And I laugh. I have asked him to participate in things before. My name is Ann Collentine. I'm the Program Director with California Mental Health Services Authority, which is a joint powers authority made up of members from 52 out of 58 counties in California who have put forth money to launch the Student Mental Health Initiative in California.
I think this is working. No? Yes? Great. So we have some questions prepared, and I think you guys know the rule, like maybe a minute or two, right? Did you look surprised? But of course, you can take as long as you want. So, one of the things that I think is on all of our minds is we want to know, let's start kind of from the beginning. Describe where you were as a system. We have the 3 systems here, and as a campus, if you need to. 3 years ago, looking at where you are today, how would you describe the short-term and long-term impact of the Prop 63 funding? How did it fit into your overall strategies to address the growing demand for services? So if you represent the system or campus, if you can share that in any particular order.
Let me start. Okay, I'll start, and I'm going to try to represent the UC system, which is a little bit of a challenge because we're a big system and we're all quite different and have different challenges. But I think one thing that we did have in common is that prior to the grant, we didn't have staffing to initiate sufficient campus-wide educational and creative outreach programs to students at risk or underserved, because most of our efforts had to go towards meeting the clinical demands, and as those demands continue to grow, it tends to erode away at the outreach and prevention services. So one of the great things about the grant program was that the money and the deliverables were really earmarked specifically for prevention services. So it really allowed us, it was protected in a sense, and we couldn't say, well, we're overrun and there's too much else going on, we have to pull those resources, and which was wonderful. And just in terms of some of the impact, it helped us to increase the visibility of the CAPS programs and really created an open dialogue about mental health concerns across the various departments and with students. We're able to really significantly increase our marketing to students at risk and to vulnerable populations. So we developed flyers and new brochures, advertising strategies, website enhancements, all kinds of things to really bring attention to what we were doing. Also allowed us to initiate significant training on campuses and how to, specifically about how to respond to distressed students. Many of our campuses had staff become trained as mental health first aid trainers and also CPR trainers, question, persuade, and refer. So that allows us just to extend the breadth of what we do by training other people. The online suicide screening program helped us to reach students we couldn't otherwise reach. We developed peer education programs. So really a long list of activities that we were able to engage in to just enhance what we do. So I think I probably used my time, but touched on a couple of things. Pass it along.
Well, I don't know if I need to really say anything.
Oh, is that it?
That ditto. When I think about sort of the theme for us of the funding and the grant, for me it really is building bridges. That 3 years ago, Cal Poly as a campus didn't really know what resources were available for our students in need. Our faculty and staff didn't feel confident or comfortable in how to respond to students or what to do with students or where to send them. Some people still weren't even aware that we had a counseling center. So there was just a lack of knowledge there. And then I think about as the CSU system, none of us knew what the others were doing. We didn't have a solid method of communication. We didn't feel connected with our other campuses, and so I think there was a lack of communication there. And then I think about our community as well. We had some really fantastic resources in our community, but we didn't feel connected to them. We didn't know how to access them. And likewise, I think they felt that they couldn't access us, and they felt like we had all of these really cool resources because we were Cal Poly, but they didn't know how to reach us and how to find that credibility and some of the wisdom that maybe we have as a university campus. So I think in these 3 years, all of those have been smoothed out and have really become connected and really interwoven. And I think what we have now is really great collaboratives. So on campus, we have an advisory group. We have definitely trained faculty and staff in some really solid trainings. We went from individuals saying, really justify to me why we need this training. What is mental health first aid and why would I ever need it? To me getting stopped downtown, when is your next mental health first aid training? We really want it. I missed the last one and I can't wait for the next one. Or I have new faculty who really need that training. Or I think this would be a great class for QPR. Can we please bring it? So just really shifting from not being recognized and also maybe not being aware to a place where now it's a need, it's a recognized need, and some of the ways that we can meet that need have been identified. And then similarly as a CSU, I think we've really created this great collaborative of individuals who support one another. I think we have lots of ideas for how to move that forward. I think we're just at the beginning of creating that bridge. And then with our community, that has just flourished. And they feel supported and excited to have access to us as a university, and I think we feel excited to know that we have these additional resources in our community. It's just a great relationship. We've done a lot of collaborative programming together, and I think each of those areas has gone very well, and it's very exciting.
This may come off more competitive than I wanted to. I read somewhere that the community college system in California, by the sheer number of campuses and students it serves, is the largest educational system in the world. So you would think that we would have a pretty significant presence within our system. Prior to 3 years ago, psychological services on our campuses were allowed to exist if you were very quiet and didn't ask for anything, but were there when the vice president or president needed you. Since then, the funding from CalMHSA has provided us a certain amount of legitimacy, not only within our system, but also with our CSUs and UC partners. 3 years ago, I think this month, we were at UC Irvine at the Mental Health Summit. And I believe that may have been the first time a community college was invited to a UC anything.
Well, not so much, but okay. I'm sure it felt that way.
Felt invited.
It felt that way. And since then, we have also, the Association for University College Counseling Centers and Directors has opened up their memberships to include community colleges, which also allows our agencies, our departments, to share from the knowledge of our UCs and CSUs and our private institutions' history within psychological services to better form our policies and procedures. And because our vice presidents and presidents look to our UCs and CSUs as their transfer schools, they also were open to the fact that we need to be doing a better job. The California Community Colleges spent an enormous amount of money and are still spending an enormous amount of money on student success. There was a very well-written student success report that did not mention mental health once in any of its pages or recommendations. So I was very excited to hear the idea and the necessity of us labeling mental health as essential, not part of, but essential to academic success. And as you, our larger system, meaning more rich system, but you don't feel that way, because no one feels that way in mental health, adopt that language. It gives it legitimacy and allows us to adopt it as well. So when the dollars start flowing, we can at least be considered. And I would like to encourage our partners to continue to work together. I know with our county, we've been very blessed to enjoy a good relationship with, but now even better relationship with, and I'm very happy that we stole one of their staff members to come over to our departments and colleges, and provided information that when you're busy and doing the work, you just don't have time to know every single service in your city, county, or area. But with CalMHSA, it allowed us to at least open the door, and I learned so much more of what we have in our county that our students just were not available to before. So we again got the legitimacy, we got partnerships. We served, I think, we had 4,000 contacts in our outreach last year. That would never, ever have been possible without the funding.
Wow, I'm sitting here just happy as a clam. As CalMHSA, and if I think back to 3 years ago, I can't believe that summit was 3 years ago. I have watched the systems start to mesh in really powerful ways. I get to see it because our contract leaders meet quarterly and they share things, you know, like the red folder is being replicated by the CSU system. The community colleges ways to communicate. They have a very sophisticated kind of messaging that they do that's been picked up by other campuses on how to message. So I've seen this shared activity. I see, you know, you see convening a peer recovery conference, you know, peer conference, a peer recovery conference. I go to those, you know, the ones that I can go to, and I see CSU students, I see UC students, I see community college students. So on a whole new level, I am seeing this knitting together, which is so powerful. I see events that start at one campus just all of a sudden not just filter through the CCC system, but filter through the UC and through the CSU system. I'm going to give you a couple of stats, and these are old stats because I was frantically trying to look for my new stats on my little iPad this morning, and of course, you know, 6:30 in the morning, couldn't find them. But it's things like 50,000 students, staff, and faculty have been trained in suicide prevention and mental health awareness in the last 3 years. 80,000 UC students have been screened for depression. We are seeing You know, we know that, staff did not know about resources. We have red folders on campuses, on UCs. They're soon to be on CSU campuses. Was told about UC San Diego now making it a phone app that you can click mental health. I know that CSU is making it a phone app as well. I think the thing that I've seen both from my perspective of counties are no longer afraid of the higher ed systems. And, they've always wanted to use the higher ed systems as their workforce. So campuses, be very aware. There is you talked yesterday about workforce shortages. The workforce shortage in the areas of mental health are huge. And if you look at the most pressing issue, if you talk to mental health directors throughout the state of California today, that is the issue. And they're looking for all of you to help them get interns that will move into their system and move into careers. And in a way that is representative of California, in the diversity of California. So kind of just want to put that out there to this audience. Be aware. Those relationships that you start and you bring resources, they're delighted. I think for me, the other thing that I wanted to say as I heard you speak is prevention. Everybody wants services. I heard all of you say everybody wants services. Services are the most expensive part of the process. And we know that individuals recognizing signs of mental health conditions happens at least 5 to 7 years before services are even requested. And it often comes at the first break. That's where prevention lies. Everyone's fear of services. Imagine if we really get to the prevention to know the signs, know the symptoms, help the students early, really what kind of harm we would have reduced, how we would have helped a student maintain his or her life and self-esteem and moved help-seeking behavior in a very positive way that isn't about services. So it's really about prevention. That is the approach that we took with this one. This is the approach as we move forward we're going to continue to take, is that prevention is important. And as you learned how important prevention is, and promotion and education, training, all of that awareness, our county mental health directors learned the same, were on the same journey. They didn't understand the value of prevention and their systems were changed. So if I look at the last 3 years, and as I look at the county mental health system prior to the influx of prevention and early intervention in mental health services, it's moving the system away from services only to prevention and recognizing the importance of prevention and increasing help-seeking behavior.
So though, like with any, I think, great experience or partnership or any new venture, there will be lessons learned. So tell us a little bit about what lessons that you learned and what kind of strategies, particularly if any of them relate to the growing demand of services, what kinds of strategies have you guys put in place that we can all learn from?
Start again?
Sure.
Okay, so one of the lessons that we learned in Santa Cruz, and I think other UCs had a similar experience, had to do with some of the logistics and the mechanics. And one thing that we would do in the future, I hope there is a next time, is to identify early in the process financial people on the campus who can help us to manage the expenses and the transfers and the invoices. And there was a lot of work involved with that, and it was complicated. I see some heads nodding out there, and a lot of trial and error, and is this right? Where's Sharon? Okay, yeah, okay. and Sharon would say, that's not quite right. Let's try it again and again. And sort of by the end, we got it figured out. But would have been nice to have figured some of that stuff out at the outset. Speaking of the outset, I think that we can also all agree that we got off to a little bit of a bumpy start. We had the original start date, but things really weren't in place, and so it really took us a good, maybe 9 months to really get the whole thing rolling. And so that would be a nice problem to figure out. So how can we have the staffing in place? And one of the challenges, until the grant started, we couldn't start trying to hire people, and then it takes time to, develop job descriptions and figure that all out and interview and get staffing in place. So and that put us a little bit behind the 8 ball in terms of meeting the deliverables, but we did eventually get there. I think that we made a good start in terms of interacting across systems, and that the Risk Summit was mentioned. I think that was a highlight, in terms of interest or inter-system connectivity, but I really think we could go further with that, and we could do more, and it could be a smoother process, and develop more inroads and commonalities, and help each other more and learn from each other more. That's the last point I would make on lessons learned. Outreach and prevention is a double-edged sword. So, and I think we all understand this, that while it does provide some primary prevention, some people who you're able to connect with and meet their needs, and they never have to come in and get the more expensive individualized service. The better job you're doing on outreach and prevention, inevitably the more people who are going to be coming in. And that's a challenge. And we were already taxed to begin with, and now, and you can look at our numbers and see that they were significantly increased. So thinking about, while we're putting those essential outreach and prevention efforts in place, how can we also plan for other ways to meet the need that inevitably is going to develop as a result of that? And there are some different kind of programs using different technologies and online services, some things that we're exploring, I think that in the future we'll be able to utilize. So some thoughts from the UCs on lessons learned. Okay.
I think one of the challenges that we were already kind of working through, college students are a pretty unique population. And so we knew we had all of this information and we really believe in prevention, but one of our struggles was, how do we get that information to the students in a way that they can receive it? And that's still something I think we're working through. But a few of our favorite things that worked. The first was, we've really worked with our orientation programs to develop a program for parents of incoming students. And so every summer, this summer I talked to a good 2,500 plus parents about our resources, about things to watch for, just really trying to package it all up for them. And the feedback we continue to hear from that is the parents say, thank you. We know our students are coming to a university where they are going to be supported, where there are resources. We feel confident in that. This is a tough conversation to have, but we know that the right people are here for our students. And then from our faculty and staff, we've heard, thank you. Our parents are now identifying their students that are in need much earlier, and we're able to intervene much sooner. So the prevention piece is happening in a way we want to see it happen. So that is one way that we found an ally and a program that seems to be working and that is definitely institutionalized for us at this point. Another that we're still kind of working on is more how to provide some things for our students in more passive ways. We know that they like to access information on their own. So we're still kind of grappling with that, working through that. One success we had was creating some PSAs, some videos. We're very, very proud of them. Our students have responded very positively to them. It's helped us brand ourselves as something beyond just the health center or the counseling center, but really this positive place where students can feel safe and comfortable, and where the conversation just starts and that it continues from there across the campus. So I think those are two areas where we've started to find our audience, but I think in some ways we still feel that we have a lot of resources for our students, and we're just trying to make sure we get them to them. And then similarly, we've really had to grapple with the increased demand for services. And I think the Counseling Center is doing a really good job with that. They created a program, sort of a new module within their services that's short-term and really hits a lot of students in a great way. I know that they're excited to start showcasing that program. But it's still an ongoing concern and across campus we're hearing that too. Now all of these students know that there's a problem, and what do we do with all of these students now that we have this? And we're having the same issue with medical amnesty, right? So now all of these students are saying they need help, and so we're kind of working through that as a campus right now, I think. And again, it's nice to have all of our colleagues at other campuses to sort of work through that with and talk about ideas and things like that.
I think I share everyone's issues with the implementation, managing the campus restrictions on spending money. Was a lesson learned the hard way. I will say, though, our foundation at the community colleges was absolutely wonderful in assisting me in getting the campus to say, well, no, you can't do that. You can't spend the money that way. And I said, well, it's kind of in the grant. And they go, well, if the funder says you can do it, you can do it. And I would call, email, and get a response the same day, and then take my email to them. Go, see, I can spend the money this way. So asking for help, that was a wonderful response. Also realizing that the thing about mental health professionals is we all know each other, and we all talk to each other. We love coming to these conferences, but in these conferences, we're kind of all preaching to the choir. What the grant allowed us to do is start talking to our other partners who might not be mental health professionals and giving them some information, learning their lingo, learning how to share information. The Red Folder were absolutely wonderful. We adopted it with help of our college in Santa Cruz, Cabrillo College, to see something, say something, do something. It was very well received, and it wasn't anything remarkable as far as the information. We always had that information, but I realized we always had the information. The faculty didn't have the information, and the staff didn't have the information, and they were in a panic, and they would call me, and I wouldn't be there. I was like, oh, wow, it may be useful if you have the information. The app was very well received. We did develop a wellness app that has numbers and resources in it. Again, with the idea of we have the information, we need to get the information in the hands of the students and the faculty and the staff. So that was a very well received product of the grant. I think that my biggest lesson is just don't give up and keep chugging through. I wasn't very well liked in our administrative services for a while, but now they at least tolerate me when I call over and try to get money spent. So.
Listening to all of you, I think I was challenged on the other end, just trying to make sure the money did work for you, and trying to be as flexible as possible with the money and being able to say no when it really wasn't appropriate. And did have to say no sometimes, but really not very frequently. I think for me, the challenge has been, this has moved so fast. For us, it's a dissemination of resources. I sit at the table here and I go, we've got our Stigma Discrimination Reduction Conference going. I'm going to shamelessly plug that you all attend or submit a presentation for this in February. It's the first time that the International Stigma Reduction Conference has been in the United States. It happens to be in your back door in California, San Francisco. Plug it to an administrator who's clueless. Sorry, that's really not nice to say, but you all have them. It's just like grab somebody who doesn't appreciate the issue and let them listen to experts from around the world talk about the issue. In the prevention, we have really coalesced around the message that if we don't reduce stigma, we don't get to where we want to be, and that's wellness, because people do not seek help at the appropriate time or they do self-harm in a way that we don't know. You are it's beautiful. You guys are the keeper of the population that we just so desperately want to reach into, and you've done a fabulous job. The alcohol behavior, the substance, the co-occurring disorder, all of the stats that your work has been so instrumental in working on that so that we don't create lifelong patterns that, this is where our young people are experiencing extraordinary things, but they're also setting those lifelong patterns, and your work is fabulous. The data is starting, we did one of the lessons we learned just in general is the importance of data. So have hired Rand, are getting data up the wazoo right now, fabulous data that you could use to take to your administrators that talk about, what's happening on campuses. Why are your students not even admitting to having issues or seeking help? So I would say for me, I've learned the importance of data. I've learned the importance of being brave enough to have weird conversations with people that I don't normally partner with, because it affects everybody, and it's messaging that everywhere I go. Even in, situations, you just kind of have fun and say, well, I look around the room and I go, 1 out of 4 of you in here is suffering from a mental health condition right now. I mean, you have fun with some of those things, especially in an audience that doesn't want to hear it. The other is that we have taken on a public health approach. So we're in it for the long haul. That's prevention. And we are wanting to change behavior and change norms. It's a huge risk that everyone is taking. And I guess I want to applaud all of you for jumping onto the journey with us. Because as I hear, I come from K-12 teaching, and we're doing the same thing in K-12 as well. Educators don't want to hear anything unless it's about academic performance. We all know that. But I feel like the conversation is changing. I feel like a tipping point is coming. I feel like there's recognition. So I think what I want to say is the learning is to seize the opportunity and to grab somebody who doesn't know and take a risk.
So as we are stronger together, the name of the panel is moving forward together. So let's just kind of shift to the future. What is your vision for continuing the collaboration and working with others, either on the panel that are representative of this panel? And maybe you could talk about the value that you see and maybe challenges as well with collaboration as we look forward.
Well, there's no doubt that the collaboration has been a tremendous highlight for what we're doing here. Not only between the systems, but even within the systems. And when I talk to my grant coordinator and the other grant coordinators, the work that they've done together and getting to know each other and sharing ideas and practices, and really on a grassroots level. We talk about things between the directors, but we're not usually the ones out there providing the direct service, and they're really providing the direct service and can talk about what's working and what's not working, and that's just been tremendous. And one of the things, just to throw in another area here that a little unrelated, when we had the response at UC Santa Barbara, we also brought together providers from all over the system, and it struck a lot of us that somehow we need to figure out a way to do more of that, bring the frontline providers together in conferences like this and have them share their ideas and best practices and learn from each other. So I'd love to find a way to continue our collaboration by doing that, by really getting our staffs together and our systems together to continue learning from each other. It was great to start to get to know the community colleges, and I think there was maybe different experiences with the different UCs. We definitely were able to develop some relationships with some of the community colleges in our area, and that I see that as just going to continue to pay dividends for us, that we can assist each other in times of need, we can share strategies with each other, we can pool resources. We really need to think more about that we're part of a community and working with the other CSUs and community colleges in our areas with the community mental health centers. So I think it's helped me to see that we have to think more broadly about our work than just what's happening on the campus. After all, where do the community college students go when they get their associate's degree? Well, they're coming to the CSUs and the UCs. So, and for that matter, where do the high school students go? And we need to be thinking more about that, how we can work, and maybe some of our peer programming can work with the high schools and start to develop prevention there where it's really needed. In terms of, part of what you asked us to think about as well was, well, if we had unlimited resources, what could we do, or what would we want to do? And as we're always going to start with more staffing, and we're hopeful that we're on the road to getting some more staffing, but we need the bodies to do the outreach, to do the prevention, to do the direct service that results from all that work. One of the great things about the grant was being able to provide training to our staff, to the medical staff, to different campus partners, and I'd love to find ways to continue that. And one of my colleagues said, it was great to be able to say yes when people asked you for something. Hey, can you do this training for us? Can you come do this outreach? Sure, we can do it. Can you help us pay for this promotion? Yeah, we can do that. We can put that on the grant. That's wonderful. So with unlimited resources, we want to continue to say yes. And lastly, a theme for me was the combination of the outreach and using creative technologies, and some of them have been mentioned here. Some of the online resources, the videos that were made, the apps. We have to stay current with the best ways to connect with our students, and we all know the technology is changing so fast, the world's changing so fast in terms of that, and we could easily be left behind. So being able to stay current, combining our outreach with creative technological advances. So give us the money and we'll do it, all right?
Yeah, he's looking at me, I'm looking at him.
How do I follow that up?
I'm sure you will.
I think that was the really wonderful thing about CalMHSA is it gave us structure. It gave us a foundation, and it created relationships, and we were able to build those bridges. I think my concern is I'm already starting to see some of that diffuse a little bit. We were just at this place where we were saying, oh, this is a great idea for us to put into place, or oh, we want to start working on having like an all-system response that's built in, that we can all support one another when something happens on one particular campus and all have that structure in place. And so we're looking forward and we're seeing all of these great ideas and all of these wonderful things. And then now we're kind of grappling a little bit with how do we do that now? So we kind of got started, and so how do we continue, I think is still the question. I've already lost my counterpart in the community college, which we were working really closely with in the same area. So it's a little bit of who's going to carry the torch, who's going to continue the work, and then how do we keep these relationships, and how do we keep these collaborations? The conferences are going to be a great place. This is a great place to start. And then I don't know, do we start some working groups? Do we all just kind of self-identify and continue these relationships? But I know that that's our wish is how do we keep it going? How do we keep the momentum? And that's kind of our question.
I think one of the things I think is really important is the marketing and our language. And yesterday we heard the idea of these are our students, meaning the global R. The community college students are our students, who will then become your students, who will then become your students. They're all our students. And if we accept that, we can move forward without having to go into silos. I think that's dangerous. As we go forward, I'm looking forward to continuing to collaborate with our partners in our community. Fresno State has been very open with us and very inviting. And I realize that I know these people. I don't need to be afraid of them. I've worked with them. I've gone to school with them. They're my colleagues. And these conferences like this are wonderful because you learn so much, you get great ideas. I had a wonderful conversation from a staff member at San Bernardino Valley College. I loved their program. I'm thinking, okay, how can I steal some of this or acquire it, merge it, the Borg, and you will be assimilated. I'm okay with that, and we should be okay with that because as wonderful as I think I am, I don't know everything. My interns, that wasn't for you. And learning from other campuses, learning ideas and saying, okay, how can we replicate that? Maybe we can't do an exact replica, but we can do a version of it. So I'm excited about going forward. The money, I'm hoping will stay and return and grow even. But I'm also thinking, I'm not afraid to go for other pots of money now. Maybe there's an organization, a foundation that will be interested in our students' success. And as our students become successful, our communities become successful. And again, our administrators can be our friends as well. And the reality is, when they go to conferences, they're with all other administrators too, and they all know the stuff that they know. So we have to be willing to attend their conferences or present at their conferences and encourage our administrators at each of our systems to talk to the other administrators at the other systems. So, because administrators they like to have what everyone else has. So if one college has this wonderful program and their college shares that at a conference, that administrator thinks, well, our college is just as good as that college. I just saw on the news that there was a rating of USC and UCLA, and I was surprised, like, really? There was that much interest in that? Yeah, okay. We can use that to our advantage. So marketing is going to be very important as we go forward, and messaging, and using the same language as we go forward. So I'm excited about the possibility, and not the possibility, the reality that we're going to be continuing to collaborate.
Well, I'm excited too. Thus, our next plan is the Each Mind Matters mental health umbrella movement, mental health awareness in California. Lime Green, mental health awareness, really kind of stands out. You can buy it on discount anywhere. Somehow it just, I gotta tell you. I think we're challenged statewide with the same thing, really coalescing under a marketing and a messaging, and we're currently working on that as we look to sustain projects. And we are really trying to do it under the Each Mind Matters umbrella, which many of you will hear about this afternoon, the Lime Green Ribbon Campaign, the use of lime green to create a national movement, and certainly in California, a California movement about mental health awareness. I want to talk about one best practice that I saw in Stanislaus County, which I really would offer to all of you as something you might consider replicating. And it was and it's it's probably a cost, is they monthly, the JC met with the CSU and met with the county and met with the K-12 liaison. So all of those folks met on a monthly basis, and they just talked. And what they found is all of a sudden, they were trading interns, they were trading resources, they were establishing events as a partnership. What CSU had to offer was classrooms that the K-12 needed to do trainings that could offer it for, so there was a wonderful and marvelous partnership. So I just offer that as a best practice, a low-cost practice. If I had endless money, we all dream of endless money. I would really love to see paid peers on all of your campuses. I would love to see paid peers with lived experience talking their talk and walking their walk in a way and in new settings that have not been, some campuses use it, some do not. But the idea, overall the mental health movement is recognizing the importance of lived experience. And if campuses could think about paid peers, educators who can, just be there for their fellow students, be there at a staff meeting, be there in a academic senate, to talk about the walk when maybe they had to leave school and they came back and were successful. That kind of, really, that's kind of my dream. The other piece is I really do love the idea of counties are a silo. You all have been able to penetrate counties. Some have not, because counties are not very friendly partners, and schools are not friendly partners too. I mean, I know that, having worked in schools. So continue to work on that collaboration with your county, because that collaboration may end up in resources for you. It may end up with, additional things that you can't get locally as your schools struggle to, kind of get the resources. So I really encourage you to continue to work with your counties, tap those resources, and what you get to offer them in return is possible interns, which is what they're looking for. So I think that's really what I want to say is I do believe that the collaboration is fabulous. I have seen the collaboration between these systems grow. It's just been marvelous, and really want to see that continue. And I think my county members have seen that as well.
So before we ask for audience questions, I'm going to ask the question of Ann that I know is probably on a lot of your minds, and I know that from the systems perspectives, we try to inform, update, educate our colleagues, campus colleagues, but can you just say what is the status of the grant? And there's been some rumors about perhaps additional funds, and you keep focusing on county collaborations, I think for a reason. So can you say more about that?
But Jerlina, that wasn't on my list.
I know, right?
that was a trick throw-in, of course, which I knew would be there.
That's right.
Right now, we are in what we call the bridge year. So all of the programs have been funded at a reduced level, and you'll see that the campus-based grants, your faculty, you've experienced shortages pretty immediately, where you've had that extra social worker or extra psychologist on campus. Unless there's been an infill of resources on the UC, you've lost that psychologist. Our campus-based grants in the UCs are, if they haven't already shut down, are in the process of shutting down by and large. The same is true of our community colleges. So we've scaled way back in terms of what we're able to provide. We just had approved our 30,000-foot, what we call the Phase 2 plan, which will start in July 1st of 2015. I'm in the process, that plan, the goal is to raise $20 million to fund that plan between now and June. I believe that we will not be able to achieve that $20 million unless all of a sudden I'm seeing some private funding source go, I want to help you out here. I do believe that we will receive a significant contribution from our counties to continue programs. I do believe that that will be at a very scaled down version. There will be a competitive process for those grants, just like there was for the first time. The board has not decided what is going to be priority of those grants. So I would love to say, ooh, I know I've got the money in the pocket. I'm very busy trying to create the messaging that will get us that money, but your relationships with counties, the importance of informing counties of the work that you've done to date, the work that you're continuing to do. I cannot express to you a more critical point for you to do that. Do it now. Because I'm asking, you know, this is getting into too much detail, but that original source of funding that funded all of your programs was a set-aside. It was a one-time set-aside of dollars. This year, I've had to go back to my members, 52 counties, to make the case 52 times for accessing dollars. I am trying this year to create the message for next year that we will not go back every year, because you can't imagine the significant amount of resources to do that, and have them make longer-term commitments, because we do believe prevention is a long-time public health model. They have modeled it. We're getting national attention. We're presenting at national conferences. The International Stigma Reduction Conference, yes, it's about the conference, but as somebody who's behind the scenes fundraising, you bet I'm hoping to find some funders there. I mean, you know, I hate to be callous about it, but, you know, Jerlina can relate. You set up events to find your funders. We are looking for funding. We have established, this is our year to disseminate materials. If you see materials out of Each Mind Matters that you like, get them out there, because if a mental health director visits your campus and they're seeing students with green ribbons, they're going to start going, oh. So, you know, I ask your help so that we can continue this. I feel very solid about it, but your relationships with county, the foundation of the funding, is very, very important. And we're moving forward. We're in it for the long haul. There is no question. We are in it for the long haul. We've modeled ourselves after the tobacco cessation campaign. I've been looking at models that are 40 years. So we're in it for the long haul. Hope that
And
answered
so
what you needed.
are we. We'll be right by your side. So I think if there are any questions in the audience, you know, some of the questions that I asked the panelists, if there are folks out there, I know that I see a few directors of counseling centers. If you have any comments in terms of perspective to the questions that was raised here, or if any member of the audience has any questions.